Foot and mouth disease has been detected in the Eastern Cape, making it the fourth province here in South Africa to have open cases of the disease. Director for Animal Health at the Department of Agriculture, Land Reform, as well as Rural Development, Dr. Mpho Maja, confirmed that the outbreak occurred on the 30th of April on a farm in Humansdorp. Mr. Dipepenene Serage, Deputy Director General at Agric Production, Biosecurity, as well as Natural Resources Management, joins us now to unpack the situation. Mr. Serage, thank you so much for joining us. First of all, let's understand how this foot and mouth disease actually affects both humans as well as animals.
This is the disease that affects animals, and it's from the buffaloes, and it's a viral disease. And as you know, viruses have got to be conveyed by what we call a vector. Vector could be a human being, could be a truck, and could be anything that would have been in contact with the disease or the surface that has the virus. In the same way as we had COVID-19. Now, in South Africa, because we've got a large wildlife and game, this virus is mainly predominant in buffaloes, but buffaloes themselves don't get sick. Mm-hmm. But when it comes, because buffaloes are slightly different from cattle. In cattle, you do see symptoms and you do see lesions, and it affects the animals because animals affected, they are not able to walk and they are not able to eat, hence foot and mouth disease. So when they are not able to eat, it means they will eventually lose weight, and if there are milk, in this specific case, in Humansdorp, this is a dairy farm. So obviously it will mean they won't be able to eat it, and they won't be able to produce sufficient milk. Does it affect humans? Yes, we take all precautions, and it's not necessarily a high concern because in human, but the concern is in the livestock and all the cloven hoofed animals. This will be your goat, your sheep, your pig, and cattle. These are the ones that would get this disease if they've been exposed to an infected situation.
And then, Mr. Serage, we understand that the outbreak, of course, started in Humansdorp. How is it then normally contained so that it doesn't spread to other areas? And what can farmers do to ensure that their cattle is not affected?
Very good question. There's what we call biosecurity. So Section 11 of the Animal Disease Act says to all farmers, as soon as they suspect that the animals are sick or are not doing what they're supposed to be doing, it could be that they're not walking to the water source. Mm-hmm. It could be that they're not walking to a feed source. They must immediately report that to the nearest department office. It could be veterinary service, it could be any other government department of agriculture, who will then come in and investigate. But farmers should, to prevent themselves from getting their animals infected, two things very important. If they buy animals from somewhere else, be they from the auction or from anywhere else, they must not immediately introduce that herd into the existing herd. So they need to keep them for a period of at least 21 days, but preferably for a month. Keep the animals away and observe if they do not have the symptoms, and thereafter they can be introduced to the rest of the herd. That is key. And secondly, farmers need to ensure that the vehicles that they transport animals with, be it from the auctions and be it from anywhere else, the vehicles have got to be disinfected so that in the event, in the unlikely event of the vehicle having had to transport infected animals before, the next herd that it transports would not harbor the virus. Like I said, this is a virus-caused disease, and viral diseases, viruses in the main, they do not themselves move. They are moved by vectors, and human beings are the most riskiest vectors of moving the foot and mouth disease.
Mr. Serage, in closing, very quickly, I mean, are there vaccines to prevent this foot and mouth disease, particularly on cattle?
Yes, very good question. In fact, how we contained, and we almost containing the virus at Humansdorp, the best thing we do is to vaccinate. We vaccinate both animals that are testing positive and those that have not yet tested positive. Two reasons. One is that those that might have been exposed to the virus, after vaccination, they no longer share the virus, so they won't be able to transmit it. And those that might not already have contacted the virus, then they won't get the virus. So we've vaccinated more than 2,000 cattle in that area.
Thank you so much, sir, for that enlightening information there, Mr. Dipepenene Serage, Deputy Director of Agric Production, on the foot and mouth outbreak, which is currently, of course, affecting areas of Humansdorp.